Hello all and welcome back. In today's episode, we're going to be exploring a supplement protocol for colds, flus, and COVID. I would just like to state that before making any changes to your diet or supplement routine, to please consult a healthcare professional and or your doctor. If you are taking any medication or are on any medication, please do not make any changes to taking your medication whatsoever. The information on this video is simply for educational purposes and is not and should not be substituted as medical advice. Now, throughout this episode, I will be referring to my notes a lot as I am reading several randomized controlled trials, and I want to make sure that I'm getting the mechanisms correct and the trials correct and not confusing them, having read them many times over. I hope this isn't too complicated, and I hope I've broken it down enough. If you have any questions or queries, please do leave them in the comments and I will try my best to answer them. So many people are coming to me saying that they've caught some kind of a flu or COVID, and it is that time of year where virulence for these airborne viruses are very high. So my aim of this video is to try and provide you with some supplemental tools that may help prophylactically or help shorten the duration of a cold, flu or COVID or lessen the symptoms. Now I'm going to move on to some antioxidant and detoxification support. I'm firstly going to start with liposomal vitamin C. So standard vitamin C is water soluble and is poorly absorbed, so you do pee most of it out. Liposomal vitamin C does increase the absorption as it's encapsulated in liposomes, which are tiny fat bubbles that resemble the body's own cell membranes. Once vitamin C is inside cells, it acts as an antioxidant, neutralizing free radicals. It also helps support immune cell function, such as neutrophils, macrophages, and T cells. It also helps regenerate other antioxidants and can modulate inflammation. These actions are relevant for respiratory infections. So a meta-analysis of randomized controlled trials found that vitamin C significantly reduced the severity of common colds by about 15%, especially for more severe symptoms. Another meta-analysis of 10 randomized controlled trials showed that vitamin C is a supplementary therapy involved in symptom relief and accelerated recovery in common cold patients compared to antiviral treatment alone. A review of vitamin C in respiratory infections, such as sepsis, COVID-19, flu, summarized that oral vitamin C, so between 2 and 8 grams daily, may reduce incidence and duration of respiratory infections. Experiments using intravenous, so IV vitamin C, between 6 and 24 grams daily has been linked to a reduction in ICU and hospital stays, mechanical ventilation time, and mortality in severe infections. So when it comes to dosing, liposomal vitamin C is definitely the way to go. Dosing between 1 and 3 grams orally for maintenance. Acute use can be up to 6 to 8 grams daily in divided doses for colds and flus, and IV vitamin C, which should only be done in hospital settings under medical supervision, can be between 6 and 24 grams daily. With respect to timing, it doesn't really matter when you take it. You can take it daily or during illness for antioxidant and immune support. I will stress liposomal forms have absolutely better absorption and bioavailability. So in summary, liposomal vitamin C absorption compared to standard vitamin D allows better cellular uptake. Inside cells, vitamin C acts as an antioxidant and supports immune cells. It also helps regulate inflammation, which are key factors in respiratory diseases and infections. Clinical studies show that vitamin C can reduce the severity and duration of the common cold, support recovery, and may improve outcomes in severe infections, including COVID-19. Moving on, I will now discuss N-acetylcysteine, or NAC for short. So NAC is the precursor to glutathione. It's one of the body's most potent antioxidants, which plays a crucial role in reducing oxidative stress and supporting immune function. So NAC exhibits mucolytic properties. Tough word for me. Mucolytic properties. This means it basically helps thin mucus, which can improve respiratory tract clearance during infections. So obviously you get quite bunged up with your nose. Taking NAC can have a similar effect to those sinus congestion sprays that you put up your nose. NAC can have a very similar effect. So it has anti-inflammatory effects, it modulates cytokine production, and it may possibly reduce the risk of cytokine storm in severe viral infection. NAC supports immune cell function by maintaining glutathione levels, which are crucial for lymphocyte proliferation and activity. So a randomized, double-blind, placebo-controlled study showed that NAC supplementation reduced the frequency and the severity of influenza-like episodes in elderly subjects. It also decreased the symptom duration. Interestingly, if you go to the hospital with an overdose or liver damage or a paracetamol overdose, they actually give you IV N-acetylcysteine. That is actually the treatment protocol. So dosing-wise for NAC, the dose can be between 600 milligrams and 1200 milligrams daily, orally divided in different doses. Timing, it says daily for respiratory support and antioxidant effects or at symptom onset. Higher doses and IV forms used in clinical settings are well tolerated but should always be used and done under the supervision of a medical professional. So in summary, NAC is the precursor to glutathione, a key antioxidant that reduces oxidative stress and immune support function. NAC is the precursor to glutathione, a key antioxidant that reduces oxidative stress and supports immune function. It also thins mucus to aid respiratory clearance and modulates inflammation. Studies show that NAC can reduce the frequency, severity, and the duration of flu-like illnesses, with potential benefits for COVID-19, although more research is needed. So let's now discuss glutathione. Now, many people resort to using NAC, which we just discussed, for boosting glutathione. And the reason being is glutathione is destroyed in the stomach acid, so it doesn't really have a good transporter. Now, interestingly, and there haven't been many trials, if any, on this yet, but I would be really interested to see one, is by taking glutathione liposomally, like we discussed with the vitamin C. By binding the glutathione to liposomes, it helps bypass the stomach acid and actually get into the system. I personally do take liposomal glutathione, and I have noticed a massive difference in my immunity. So let's discuss what glutathione does. So glutathione restores antioxidant defense. It combats reactive oxygen species, which are generated during viral infection. So glutathione neutralizes this. Oxidative stress can worsen inflammation and lead to tissue damage. Glutathione helps maintain the effect of mucosal surfaces in the lungs and the airways, helping to prevent viral invasion through damaged epithelial cells. It helps balance pro- and anti-inflammatory cytokines and may potentially reduce risk of cytokine storms during severe infections, especially relevant in COVID-19. Glutathione is essential for optimal function and proliferation of immune cells like T cells, which are key to clearing viral infections. It also helps boost local defense in the nasal and respiratory tract. Aerosolized or oral glutathione has been shown benefit in relieving upper respiratory symptoms. Some studies suggest that glutathione may impair viral replication by maintaining redox balance and interfering with viral protein folding processes. Case reports and small studies suggest that glutathione, oral or through IV, may relieve respiratory distress and improve oxygenation in COVID-19 induced pneumonia. So with respect to glutathione dosing, so orally between 250 and 500 milligrams liposomally. The bioavailability does vary between different supplements. You want to try and get a liposomal glutathione if possible. You can take it daily for maintenance of acute respiratory illnesses and other diseases. Remember, oral bioavailability is limited, so liposomal is favourable and preferred. IV is also used for severe cases. Once again, that is under medical supervision. In summary, glutathione is a key antioxidant that prevents against oxidative stress during viral infections. It helps to reduce inflammation and tissue damage, it supports mucosal health in the lungs, and it balances the immune responses and aids in immune cell function. Preliminary evidence suggests it may reduce viral replication and improve respiratory symptoms in infections like COVID-19. Please consult your healthcare professional or medical provider before making any changes to your diet or supplement routine. Supplements also need to be seen as supplements. They should not be a substitute for a high-quality, bioavailable, nutrient-dense diet, or good sleep, hydration, and exercise regimens. Thank you very much for sticking with me through that video. I hope that was useful to you. I will catch you in the next one, and that was Science Made Simple.